facing at the side of the patient. And thinking about the anatomy of the ulnar nerve running along that medial aspect posterior to the elbow. So these first two, we were extending the elbow. On the ulnar nerve, we're going to be flexing the elbow to tighten it up, to tighten the nerve around the elbow. So our process here goes, depressing the shoulder is not listed on here, but I think it should be part of it. And I think some of the resources out there will tell you to fix it in some way, which means I then will use my body to help me abduct and externally rotate his arm. And so I typically will go into abduction first, then external rotation. So I get him to this position where I've fixed his shoulder, I've abducted and externally rotated the shoulder. How are you here?
Good.
And then we're going to pronate and flex the elbow and pronate the forearm, bringing his hand kind of towards his head. So if you break that down, you can flex here, then you can pronate. And then we want to get that finger and wrist extension going. So kind of bringing his fourth and fifth fingers towards his chin or ear, and that's going to wind that nerve up all the way. Does that feel okay? So again, you're going to start at the side. I'm resting his arm on my hip, depressing his shoulder. I'm going to bring him into abduction and external rotation. Flex the elbow, pronate the wrist, bring those fingers down towards his ear and chin.
Hey, Brian.
Yeah.
Could you flip around and
Yep. On the other side, or how do you want me to go?